My name is Chris Sampson. I work at the Office of Health Economics, also known as OHE. So we're an independent research organisation and a consultancy based in London. And we're mostly made up of health economists who have graduated from master's programs in health economics, some more recently than others. Today, I'm going to talk to you about student mental health, which is a topic that I've been working on a bit recently. I'll be kind of pitching this talk to you about student mental health, kind of assuming that you know nothing about this research area, and perhaps not even much about health economics. But I'll signpost plenty of publications and online sources where you can find out more if this really interests you. I will gladly share these slides, and I believe you'll be given access to a recording once this session is over. So don't feel the need to kind of take screenshots or scribble down references or anything like that. All of the sources that I'll cite today are kind of linked within the slide, so you'll be able to find everything that way. So before we get started talking about the research, let's consider why we should actually be interested in the mental health of higher education students. To be clear, when I'm talking about students today, I'm talking about higher education students, so students at university. I reckon many of you here are either students right now or you work with students regularly. So I'm probably preaching to the choir on this, but the topic is of interest outside of our circle as well. The media love a crisis, and the student mental health crisis is something they've been covering for quite a few years now. As researchers, I think we can help figure out whether there's any truth in these claims and whether it's as big a deal as the papers like to claim. We do know that there are well over 2 million higher education students in the UK. So we're talking about quite a big chunk of the population. We might also believe that they're a particularly interesting group for economists. Universities, at least in part, are there to kind of develop human capital and build an effective labour force. So I think there are considerations that go beyond health outcomes for the broader economy. At the risk of kind of stating the obvious, we also know that most higher education students are young people. And many mental health problems first arise in adolescence. So if we're interested in early intervention, then universities are probably a good place to look. And finally, I think it's important to consider another kind of special feature of higher education students, and that's the institutional setting of universities. Students are kind of located within a network of services and supportive structures that in theory should facilitate their access to effective interventions. In essence, I think students are kind of a very reachable population compared with some other populations. So I think this is a few reasons why we should be thinking about student mental health, and I'll talk about why I think health economists should be playing a role in this. So the title of my talk today mentions crisis and cultivation. Clearly, the crisis is that which the papers refer to. Cultivation here, I kind of refer, obviously, alliteration was the main reason I chose that word, but cultivation refers to the kind of broader role of universities in students' development, and more specifically to kind of effective interventions that might be implemented to support students' mental health. This slide kind of highlights some of the questions that I think are relevant here for us as researchers. I'm not going to try and answer all of these questions for you, but instead I'd like to try and kind of equip you with the necessary information for you to make your own judgments about these things. So to do this, I'll be talking you through the research on a variety of kind of specific topics within the area, and focusing particularly on those that fall broadly within the scope of economics or health economics. And here are those topics. So I'll first provide a bit more background on the landscape for the kind of research on student mental health. I'll introduce you briefly to a program of work that I've been involved with called SMARTN, the Student Mental Health Research Network. And then we'll talk about the measurement of outcomes for students preferences for treatments, the kind of interventions for which there is actually an evidence base that exists, and then how we might think about the value of investing in services for students. And then finally, I'll just kind of sum up and leave plenty of time, hopefully at the end, for questions and discussions, if anyone has anything they want to raise. So I think throughout the talk, we'll not kind of take questions live, because I think it's a bit tricky in the virtual setting. So if you do have any questions, please jot them down and we'll come back to them later. So firstly, I'd just like to take you through some of the key issues and some of the kind of headline statistics relating to student mental health. So as we've seen from those headlines, there's something going on here that people like to call a crisis. But the question is, what's going on? So I think perhaps the most important thing to know is that a lot of students seem to suffer from mental health problems. So there's one study cited here by Sheldon and colleagues. They found that the average prevalence of depression across studies in university student populations, undergraduate student populations, they found that the prevalence of depression was 25%. That's compared to an estimated prevalence across kind of high-income countries, more like 14%. There's even a study from the US cited here suggesting that more than 60% of students have a diagnosable mental health problem. That's in the US. And they also suggested that this figure is increased by nearly 50% since 2013. So prevalence seems to be a kind of big part of the crisis here. I think if you pay attention to the news, you'll no doubt have seen some of the tragic stories about university students who've taken their own lives. One recent study here found that the incidence of suicide for students in England and Wales only is about 4.7 per 100,000 students. Well, of course, we'd like that to be zero, but actually this figure of 4.7 is actually lower than we observe in the general population. So the incidence of suicide across the UK is more like 10 per 100,000. But this Gunnell study here does also suggest that the rate of suicide in the student population is on the rise, though this is something that we see kind of across young people in general in recent years. When university leaders talk about mental health crisis among their students, often what they're thinking about is actually what we tend to term help-seeking behavior. So what this means is that universities have seen an increasing demand for mental health services in recent years, and many universities are kind of struggling to keep up. Unfortunately, we don't really have great data on this because most of it is held by individual universities, but there are some studies that report on kind of surveys, smaller surveys. But yeah, the data are quite limited. I think, of course, more students needing support for their mental health sounds like a bad news story, but it could also be the result of more young people with mental health difficulties just having the opportunity to go to the university in the first place. So it might be that actually universities are increasingly becoming responsible for services that just would previously have been provided by the NHS or by other organizations. Finally, I think it's fair to say that universities are being blamed for some of these kind of challenging trends. I think in part there's a perception that universities aren't doing enough to support students because I think the excess demand for services is kind of giving rise to long waiting lists or to students just not being able to access services that they need. But I think there's also a more fundamental issue at play as well. I think many academics will tell you that universities are kind of increasingly becoming part of a neoliberal machine serving the purpose of the wider economy, kind of turning customers into employable, human capital. The kind of argument around this goes that this creates an environment in which students' well-being is kind of being sacrificed in the name of a better CV or worse, for the better performance of the university. I have some sympathy with this perspective, but the question remains about what can or should be done to support students needing support for their mental health. As I go through these slides through this talk, we'll look at some more evidence around these topics that I've just raised. So something that kind of keeps me interested in the topic of student mental health is that I think it's especially complex. There's a lot going on. So research questions in mental health economics in general are often more complex than in other areas of research, but I think there are some kind of extra peculiarities in student mental health that make it even more interesting. So some of this I'll go into in more detail later, but right now I'd just like to kind of provide this overview. So when we're thinking about health-related interventions for students, I think there's a complex range of outcomes that are relevant. So of course we are interested in the health outcomes, but we might suppose that these are kind of equivalent to other contexts. But then on top of that, I think it's impossible really to ignore educational outcomes. So we might expect these to be influenced by mental health, but we also might expect there to be the reverse relationship as well. So this adds an interesting complexity to capturing the value of support for student mental health. I think it's important to consider that most students with mental health difficulties are not people that we would kind of normally classify as patients. So it's perhaps for this reason that many researchers who are working in this area, they prefer to talk about kind of a broader conception of well-being that captures a lot more beyond just kind of functional health outcomes. I think perhaps even more significant than any of that is the fact that we need to consider many different perspectives or sectors when we're thinking about student mental health. So we have to remember that higher education students, by definition, are part of kind of identifiable communities with shared needs and resources and interests. And we might like to therefore consider kind of broader conceptions of community well-being. I've already mentioned that educational outcomes at the individual level are important, but of course students' academic results also help to determine how they'll contribute to the wider economy kind of in the long term, and this is something that we need to take into account. I think one of the biggest challenges in my view is the question of who should be providing support services for students. So local health, NHS health services might not have the capacity to support kind of high concentrations of student mental health needs. And meanwhile, universities might not be well placed to provide kind of appropriate full range of services. Or if you hold the more kind of cynical view that I mentioned earlier, it might not be in the commercial interests of universities to provide those services. So hopefully something that you'll kind of take away from this is that there's a need for research in this context to be multidisciplinary, which brings me to the next part of my talk. I'd just like to introduce you to SMARTN. So this is the Student Mental Health Research Network. So SMARTN was funded in 2018, and it's just kind of coming to an end right about now. So it was led by researchers at King's College London with kind of a range of co-investigators from universities and charities and independent research organizations, myself included, from across the UK. And as the name suggests, we set out to build a network, essentially. So the objective of the funding was not so much to kind of conduct research ourselves, but rather to build capacity more generally in the field, particularly in the UK. So that meant providing support to new researchers. It also meant kind of connecting people across sectors and across disciplines with the objective of trying to kind of identify solutions to the problems that I've just been outlining, to those kind of tricky challenges that I've mentioned. So in particular, we wanted to facilitate the adoption of evidence-based approaches to supporting students' mental health, because this is something that we, as a group of researchers, had seen kind of lacking in the past. So throughout the program, we focused on kind of 3 key research questions. I won't read these out. You can read these yourself. But hopefully you can see just from looking at these that there's potential for economics research to come in relation to all of these. There's lots of scope for health economists to kind of get involved in this area of research. So as I mentioned, the funding for the Smarten network has kind of now come to an end. But I would encourage you all to visit the Smarten website that's mentioned there on the slide if you're interested in this topic. I think we've achieved quite a lot over the years, and you can find a lot of what we've done online. There's quite a lot of resources that are available that are useful to researchers. I think one of the ways in which we've kind of had biggest impact was in kind of changing how research is conducted in this area. So we worked really closely with students throughout to kind of co-produce the research, and I think that's a really valuable part of what we've been doing. We kind of took a kind of truly inclusive approach to involving lots of different stakeholders at all stages in the research. All right, so now I'd just like to talk you through some of the key research topics in this area. So the first one that I've brought up here, it relates to the measurement of outcomes. So throughout these sections, I'm not going to be providing anything like a comprehensive overview of the research. That would take all day. Rather, I'll just introduce kind of what I see as a couple of key studies, a couple of relevant studies, and discuss some of the ways in which I think health economics research either has previously come into play or how it could come into play in future. So one of the first things to note, I think, is that economists have not contributed much to the question of measuring mental health related outcomes for university students. But I do think there are several ways in which economists should be contributing. And so I'm going to touch on some of these now. I think the econometric methods, so statistical analyses of kind of larger data sets, these methods are quite well suited to understanding factors that are associated with student mental health. And there are studies in this context, but I would say that for the most part, they're based on kind of smaller cross-sectional surveys or kind of qualitative methods. So for instance, this study here by McIntyre and colleagues, it showed that social connection is really important. I think this is a topic that's kind of ripe for investigation by economists. One example from economics is a study that modeled unmet need. So this is the Cullinan study cited here. So this study modeled unmet need for 6,000 students in Ireland. The researchers found that students from a lower socioeconomic background had higher rates of mental ill health. and they found that it's this that was driving the disparities in outcomes. So I think this is a really useful contribution to the literature. More recently, I supported an economics student in conducting an econometric study, and this was looking to understand whether actually becoming a student has an impact on mental health, which is a surprisingly tricky question to answer. This study isn't published yet, but the results show that there kind of isn't a clear effect. The effect that you measure kind of varies depending on the methods that you employ. But once you kind of do a good job of controlling for selection issues, it seems like any change in mental health outcomes that does occur, we might have expected that to happen anyway, even if that the young people in the study didn't enroll in university. So it's not clear that becoming a student has any impact on your mental health. Another study, a study from our Smarten network, some of my colleagues looked at outcome measurement practices, both in research studies and also within universities, kind of in routine practice. And they found that practice varies a lot. So in general, I think I would say that there are kind of two approaches to measuring outcomes for students, neither of which is totally satisfactory. So on one hand, you have universities and some researchers using instruments such as the Warwick-Edinburgh Mental Wellbeing Scale, or WEMWEBS. This is a generic measure of well-being, and we might not expect it to be kind of sufficiently sensitive to some of the challenges faced by particular groups of students. So it might not capture everything that we're interested in. Then on the other hand, some research, especially that which relies on kind of routinely collected data, some of that research uses instruments that are more suited to kind of clinical assessment, particularly of anxiety and depression. And as we've already discussed, kind of most students aren't patients, and there's not a lot of people who think that these measures are kind of the most appropriate way to capture outcomes in student populations. In my view, I think there's a need to measure health-related quality of life in this context, and we see a gap here. And I think this is a space where health economists are doing a lot of work outside of the context of student mental health, and I think there's an opportunity to contribute here. So an area where economists have contributed is around students' preferences. So I'd like to highlight a couple of studies on this topic. I'd also like to consider in this part of the talk the issue of help-seeking behavior, which I mentioned earlier, and which is kind of one of the ways in which people have perceived there to be a crisis in student mental health. So understanding what students actually want in terms of services, I think, is an important part of figuring out the supposed crisis in high levels of help-seeking behavior. So one study by Walsh and colleagues cited here, this involved a discrete choice experiment. So in this study, more than 5,000 students in Ireland, they were asked to make choices about campus counselling services. So in this study, options were specified in terms of things like opening hours and methods of contact, but the dominant attribute within the discrete choice experiment was waiting time. So students were willing to pay quite a bit more for shorter waiting times than for differences in other attributes. So I've stolen this first table here from that study. So if we look at those numbers in the three columns on the right, we can see, for example, we can see that students are willing to pay as much as €85 more for a 1 week wait compared with a 4 week wait when it comes to counselling services. I think this kind of information can support universities in designing their services, and I think contributes to what I mentioned earlier about the need for evidence-based services. Now, one of the kind of major and most frequent findings in this whole research area is the role of stigma. And this is something that has come up in quite a few studies that have been led by economists. So I'd just like to highlight one of them here. There's quite a few to choose from, but I've selected one which is a slightly older paper from 2009. This paper is from the US, but we do also see similar findings from other countries. So there are studies in the UK, in Europe, Canada, Australia, and they have quite similar findings. Findings around stigma are quite common in this context. And the common finding is that stigma plays an important role in help-seeking behavior. So higher levels of stigma around mental health, they make students less likely to demand services from universities. Now, there is some kind of nuance here around a distinction between personal stigma, which is essentially about people's attitudes towards themselves, and public stigma, which is about how society kind of judges or is perceived to judge mental health needs. And different studies find kind of slight differences in the relative importance of these. But here's another borrowed table of results. So this table shows regression results for different outcomes. So the bottom half of the table shows the findings for personal stigma. And what we can see, if you squint at those tiny numbers, is that stigma doesn't just reduce a student's use of therapy and medication. It also influences their own perceived need for support. So one of the reasons that I've chosen a slightly older study here is that this study, to some extent, kind of dates back to a time before the crisis of student mental health was a really regular topic for discussion. So I think what this provides is one possible explanation for why help-seeking behavior might have been increasing in recent years. And that is that personal stigma among students with mental health needs, it may have reduced in recent years, in which case any increase in demand for services might not reflect an increase in need, but rather an increase in a willingness to seek help, which is quite a different problem to the crisis as it has previously been described. So now I'd like to talk about evidence for healthcare interventions and services to support students' mental health. So as I mentioned earlier, this was kind of an important part of the scope of the student mental health research network. So it's kind of somewhere that we've focused quite a lot of our attention. So many health economists spend their time investigating specific interventions. And there is, of course, kind of plenty of scope for this in the context of student mental health. Perhaps the first thing that might come to mind for you when you think about mental health services for students is counselling services provided by universities. And certainly this is a very important part of the provision, and some estimates suggest that as many as a third of students make use of these services, so they are important. But actually there's very little evidence on the effectiveness of counselling services within universities. Probably this is because these services have kind of existed for quite a long time and there's not really any imperative to generate new evidence of their effectiveness. But there is evidence to support other types of interventions and services for students. And you'll find, if you look in the literature, you'll find quite a few systematic reviews available that describe this effectiveness evidence. I would say that internet-based interventions are probably one of the most researched groups of interventions, and there are several systematic reviews of these internet-based interventions alone. Here I've just cited one in which the authors reviewed 48 studies, and they found some good evidence to support internet-based interventions for students with depression, anxiety, stress, eating disorders. So yeah, a whole variety of things. There's quite a large literature there. Some people believe that it's kind of the nature of teaching and learning that can have a negative impact on students' mental health. So we might think that interventions should be embedded within the curriculum. But a recent review cited here by some of my Smarton colleagues didn't find the evidence to support this idea. There's also other review studies that kind of focus on specific outcomes, such as stress. But in general, there's some good evidence to support the provision of psychological therapies for university students. And there's also a growing interest in kind of campus-wide initiatives. This is quite a popular topic at the minute, designed to support students' well-being more generally. But as yet, there's not very much effectiveness evidence in this area. But we're economists, so we care about how much these interventions cost. And ultimately, we want to know whether these interventions are a cost-effective use of limited resources. So some colleagues and we set out to find any economic evidence on interventions for student mental health. And our review isn't actually published yet. This citation here is just to our protocol that's online. But we sought to include any study that reported on the cost effectiveness of an intervention in the context of higher education students, or just reported anything about costs in the context of university students, and we found very little, even for the psychological therapies for which there's some good effectiveness evidence. Cost effectiveness studies just haven't been conducted. Exactly why this isn't really clear to me. It could be something to do with kind of reliance on university funding for these services rather than kind of public expenditure through the NHS, but I'm not sure. So continuing from the point I was just making about cost effectiveness and analysis of economic outcomes, let's spend a bit of time thinking about the value of investing in student mental health, and also kind of how economists have contributed and how economists can contribute to this area of research going forward. So shoehorning this in a little bit, but something that I haven't really mentioned yet, but I think is an important part of economists' work in this area, is around policy evaluation. So this is something that health economists, a lot of health economists spend their time doing. So there's quite a long history of research on the relationship between education and health in general, or between education and mental health. So many of these studies relate to kind of policy changes, and a lot of those policy changes are around the number of years of compulsory schooling. So across the world, there have been changes over the years in how long children have to stay at school. There isn't a great deal on universities specifically, but I think it's important to remember that the role of education is really important to consider when you're looking at the mental health of students. There is one study that I've cited here by Kamhofer and colleagues that did look at university specifically. So they were making use of some policy-related variation in the accessibility of higher education. That was in Germany. And they found that there were benefits associated with attending university, which is probably a relief to lots of people on this call. And they found that these benefits were not equally distributed, which perhaps is not a huge surprise. Some people gained more from university than others. But I think of most interest to us in this context is that they found no effect on mental health. Here's another borrowed table. So the column headed MCS, that stands for Mental Health Component Summary Score, which if you start reading research in this area, you'll see quite a bit. And the results here in this table show that mental health is the only health-related outcome for which a university education does not provide a significant positive return. But as I say, unfortunately, there are essentially no studies on the impact of policy changes on the mental health of current students. So there's a really big gap in the literature there. So if we kind of add that to the finding that I was just discussing, that there's also very little on the cost effectiveness of specific interventions, it makes you wonder kind of what might be necessary to kind of support more work in this area. And one thing, in my view, is that there's kind of a lack of tools and methods that can kind of adequately inform decision making about investments in student mental health. Partly this is because researchers haven't been dedicating a lot of time to this topic for many years, so it's relatively new, and partly I think it's because of the complexity. As I've already highlighted, there's a variety of perspectives that we need to take into account in this context. So, universities are seeking to understand the return on their investments. We also need to identify the appropriate allocation of resources to NHS services that support students. I think it's also important to consider students' own out-of-pocket expenditures. And I think with all that in mind, I'd just like to introduce you to a small project that we've been conducting as part of the Smarten program, which is still underway. So we're developing what's called a resource use measure, or a RUM. If you've done any reading around cost effectiveness analysis, particularly kind of trial-based cost effectiveness analysis, you might have come around this kind of phrasing before. Generally speaking, the purpose of a resource use measure is to try and accurately describe any of the kind of cost-related outcomes within an evaluative research program. So yeah, you'll find that they're an important part of cost effectiveness research, and in that context, participants will self-report their own use of healthcare services. And these will be used to inform cost effectiveness analysis and the estimation of the cost of different services. So this screenshot here is an example of a generic resource use measure for anyone who's unfamiliar with these kinds of questionnaires. And actually, we're designing our RUM to be an extension to this generic measure. But we're also developing our RUM with the intention that it might be useful beyond cost effectiveness studies. So in particular, kind of given the importance of universities in this context, we really want the resulting questionnaire to provide information that will enable university administrators, staff within universities, to understand the costs that are associated with the services that they're currently providing, especially indirect costs. So if a university, if an organization, part of a university wants to kind of better understand the efficiency of, say, a counseling service, then they need to know not only about kind of the direct costs of providing that service in terms of kind of staff time and having a room and all that stuff. They also need to know about any knock-on effects for students' uses of other services. So, universities provide a wide range of services, and it's likely that there are associations between different ones in terms of how often students make use of them. We also want to inform decisions about decisions that kind of optimize resource allocation across sectors. So if a university is expanding its provision, a research project should seek to identify how that extension of provision impacts on NHS service use as well, because we're interested in what's happening across the whole system. So as part of the development of our resource use measure, we sent out a survey. So we surveyed researchers and students and professional service staff in universities. So we wanted to understand what were the most relevant and important items for inclusion in our measure. So, in principle, we could create a questionnaire that had hundreds of questions, but that's not especially useful in any context. So there's a prioritization exercise that's necessary. So we analyzed these data from the survey alongside the findings from our systematic review that I mentioned earlier. So we were able to learn from the few studies that have conducted economic analyses in this context. I would say that for the most part, the survey kind of confirmed our expectations about the importance of counselling services. And it also indicated that the main community mental health services that are available were important for students. I think perhaps where the survey was most useful was around kind of wording and framing. So different universities refer to similar services in different ways. And we need to create a questionnaire that can be easily understood by students everywhere, at the very least across the UK, but ideally even beyond the UK. All right, so as I promised, I'm going to leave a good chunk of time for questions if there are any. So I'll start to bring the talk to a close now with just a few conclusions and things for you to think about after you hit the leave button on this meeting. So I think you could go so far as to say that there's been quite a bit of hype around the student mental health crisis. But there's no doubt that a lot of students are suffering from mental health problems. And it seems pretty clear to me that some of them aren't getting the support they need, even if we don't have brilliant evidence on this. The various studies that have been done do suggest that there's quite a bit of unmet need. And I hope I've convinced you during this talk that there is kind of some really interesting complexities around student mental health, which make it kind of difficult to identify solutions, but they make it all the more worthwhile to research. I think in terms of economists' contributions to date, I think there's some really valuable work that's been published around students' preferences for treatment and also the determinants of their help-seeking behavior. There's a reasonably big literature around that. I think part of our role as researchers is to kind of support evidence-based practices that take these findings into account. But there are also areas where economists really could be doing quite a lot more, particularly around meaningful outcome measurement. So the development of meaningful outcome measures that can be used to inform resource allocation decisions in particular. I think simply put, we need researchers to start conducting cost effectiveness analyses in this context because there's a big gap there. And finally, although this area of research has developed quite significantly particularly over the past 5 years, but over the last 10 years, supported by initiatives like the Student Mental Health Research Network, I think there's still a lot that is left to be done in terms of kind of building cross-disciplinary capacity. And I hope that kind of some of you here today on the call, after seeing this talk, I hope that you'll kind of be able to help make sure that the health economics discipline as a whole kind of establishes itself as part of this movement, because I think health economics has quite a lot to offer.
Thanks, Chris. Thanks for joining us for the June Mental Health Economics talk. I mean, we've created this series of talks with the objective in mind of sharing current and future research in mental health economics. And clearly what we've been talking about today is extremely important, and there's so much that still needs to be done. So hopefully people kind of leave today with some food for thought for stuff that can be done. I'm collecting questions from the floor, if there's any. You can either put it in the chat, raise your hand, or just I guess I'm not sure you can unmute yourself, but Samina can unmute you if you raise your hand. While we wait for that, I may just ask you something. So you talked about ways of measuring usage of services But what about also the debate about how to measure mental health using surveys? I mean, economists have gone for the easy way of just using GHQ, the SF-36, measures that are available in large-scale surveys, and chucked it on the right-hand side, on the left-hand side of the equations, depending on. But how do you think we can actually go about understanding which outcome should be collected, given that different people, I mean, I have in mind, for instance, the funders, the individuals, the government, the health sector. If you ask these different people, and we could name many more, they might tell you that actually what's important is something else, or they may not agree on what needs to be measured. How do we solve this if the NHS is collecting something that then the funders don't think is what should be collected as an outcome?
Yeah, I mean, it's certainly a challenge. So I think one of the issues in the context of student mental health is that we're not just talking about a particular patient group. So we're not just talking about people with anxiety or people with depression or, you know, any individual condition. We're talking about a really varied group of people, but across this group of people, universities, other stakeholders need to make decisions about investments. So there's at least two ways to do this. So either we can kind of collect all of the individual instruments that are relevant to all of the people within that population. And I think, you know, then you end up with a long list of data requirements, and, you know, you're collecting extensive questionnaires from students to find out whether kind of current services are improving outcomes for them. And, you know, in most cases, that's just not practical, which I think is why most universities have gone for the other option, which is to capture the kind of most generic outcomes possible. So try to measure well-being in a, you know, relatively brief questionnaire. But actually, you know, these well-being instruments, you know, often are not kind of comparable to other studies. They might be informative within universities, but, you know, they might have limited kind of responsiveness to changes that universities might make. So we have a real challenge. And I think there is somewhere in the middle, which is to kind of try and do a good job of describing students' health-related quality of life, which is kind of more specific than generic well-being outcomes, but doesn't have the kind of clinical connotations of a lot of the instruments that do provide scope for comparison with other populations, but don't provide much use for comparing individuals within the population. So I don't know the exact solution, but I think that there's scope for more work around kind of properly, as fully as possible, describing people's health-related quality of life.
Thanks. And that, I mean, linked to what you just said, what do you think is there any room for collecting qualitative data? I mean, economists are usually dismissive, I may say, about qualitative data and tend to focus more on quantitative information, maybe. But don't you think that maybe this is an area where we should give more space to the collection also of qualitative data?
Yeah, and I think there's a reasonable amount of qualitative research with students in this context now, and I think, excuse me, I think economists would do well to pay attention to it, because, you know, a lot of these studies are conducted for a particular purpose, whether it be to just describe a particular subset of the student population or with an interest in a particular outcome. But there's a lot that can be learned from those studies that is informative to the more general challenge of resource allocation. And I think I don't see qualitative research as a kind of optional thing that we could think about. I think when we're trying to decide what are meaningful health outcomes to a population, we have to think about qualitative research. We have to speak to people who are experiencing the things that we want to be able to describe. And we also need to be able to describe those experiences in a way that is meaningful to this population. So I think it's a necessary part of research. And I think, you know, a lot of economists aren't kind of well equipped with qualitative research skills, which is fine. It's just the reason that we need to work with people who are well equipped with those skills and collaborate on that.
Yeah, I couldn't agree more. While I wait for hands to be up, I take advantage of the fact that you're here with us today. And I wanted to go back to something you mentioned about a study that looks at social support and how that can help us bouncing back. And is there any work which is in the pipeline stemming from the measurement that you have mentioned, the Smart 10 project, focusing on social support?
So I mean, there's a few different strands to it. So one thing that I'll mention is that there's quite a lot of work now around peer support, which is, you know, to some extent born of that kind of social connection aspect, and there is a growing body of research around the effectiveness of these peer support interventions. So I think in that sense, that research can inform the design of interventions. But I don't see much work around how we capture the value of that social connectedness when we're understanding well-being outcomes or mental health outcomes. No, I think that's something that really deserves a lot more exploration, because there are quite a few studies that kind of signal that it's important. But what you can actually do to make the most of that dynamic, how we should interpret it and how we should use it in the design of services is not totally clear, or how strong the effect is relative to other aspects of students' lives. So no, I think that's a gap, and I'm not aware of any kind of big developments on the horizon in that space.
I know that there's some field experiments being done in developing countries, and I was wondering whether that could be replicated or adapted to the university environment. It shouldn't be too costly. I mean, for instance, the idea of a friendship bench where you can
no, I think that it's a good suggestion. I think there's plenty of opportunities for connections with other areas of research where, you know, particular research questions are more developed.
Thank you, Chris. If there's no other question, I would just like to thank you for being with us today. And Chris will be more and more involved, I hope. There's a question Samina's telling me. Sorry. There's a question about careers opportunity and employability, but I think, would that be for me or for Chris? I'm really confused. Do you see? I don't see that as being a question for Chris, to be honest, but maybe the person.
Very happy for anyone to take questions away from me.
Okay. Thank you so much, Chris, for being with us today. And as I was saying, you're gonna hopefully be more and more involved in the program. So people will see hopefully more of you in the next few months.
Yeah.
Thank you so much for being with us. Oh, there's a hand up actually from John. Can Samina just, we can't see you, but we can hear you.
Yeah, my apologies. I actually didn't have a question. I just wanted to say, give a round of applause to Chris, because I really enjoyed the talk. So not a question, just a comment that it was really informative, really interesting. And thank you very much, Chris.
I'll take that. Thank you.
Thanks, John. And thanks for being with us today. No other questions? No? Okay. Bye, Chris. Thank you again.
Thank you.
Thanks.